Hello, my name is Jeroen Hendriks. I'm a professor of cardiovascular nursing at Flinders University and the Royal Adelaide Hospital. And I'm delighted to talk to you about integrated care for atrial fibrillation and to discuss the key components of integrated care with you. I don't have any disclosures. As you probably know, atrial fibrillation is the most prevalent cardiac arrhythmia, with about 43.6 million individuals affected globally in 2016. It's also considered the most common cardiovascular cause for hospitalization. And looking into this figure on the right-hand side, this is Australian data from Celine Gallagher, who looked into a 20-year period of time regarding hospitalization, and where we can see that AF-related hospitalization, here represented in the blue bars, shows a steep increase over the years and is now outnumbering hospitalizations for important cardiac conditions such as heart failure and myocardial infarction. And you will not be surprised that this increase in hospitalization goes hand in hand with an increased cost. So the question raises, how does the future of management, of AF management look like in the near future? And also, do current care models, are they suitable to provide the required care, or do we need to explore novel models of care delivery? And that is actually what integrated care is about. So integrated care has been identified to manage patients with chronic conditions and multimorbidity. And it's actually a worldwide health reform and implementation of novel models of care to prevent fragmentation. The aim is to improve access and quality of services, but also to improve efficiency and outcomes of care. And as we can see in the figure here, there's in the central position, there's a patient with a chronic condition, and the care is organized around the patient with several fundamentals. For example, coordinated services, a team-based care approach, and the use of technology to actually support this integrated approach. In 2016, the European Society of Cardiology advocated for an integrated care approach in atrial fibrillation. And what we see here is from the 2018 Australian guidelines, who actually also incorporated this approach consisting of 4 major fundamentals: a multidisciplinary team approach, patient-centered care, e-health to support the management of atrial fibrillation, but also to support integrated care, and providing comprehensive treatment in atrial fibrillation. And it was stated that integrated care is recommended in all patients with atrial fibrillation, and such an approach aims to provide patient-centered, comprehensive treatment delivered by a multidisciplinary team. Now, recently, the European Society of Cardiology updated their guidelines, and these were presented during the virtual ESC conference in August. And they came up with a new structure. It is called integrated AF management. But I think if we go through this, we will see the 4 fundamentals of integrated care fused in this approach. So first of all, we need to have a patient-centered care approach with active patient involvement, where we focus on patient education, on self-management, lifestyle modification, but also in psychosocial management. Secondly, the care is provided by a multidisciplinary team, providing comprehensive treatment. And we'll talk about that in a minute a bit more. And this is all supported by technology. Now, let's look into these separate fundamentals. So first of all, a patient-centered approach, active patient involvement in their care process, requires a central role for the patient in their care process. So as healthcare providers, we need to first engage with the patients to identify their needs, values, and preferences, and to align that with the recommendations from the guidelines. Also, it's really important to empower patients to undertake self-management and focus on their lifestyle modification. But before patients can take on such roles, it's really crucial to educate them and to provide them with instructions, not only how to take their medication, for example, but also how to work on their cardiovascular risk factor management. And well, once we have done that, so once patients are well educated and instructed, we can also invite them to be involved in informed and shared decision making, which may take up the uptake of the treatment even better and may lead to better outcomes. Then the second fundamental is that the care should be delivered by a multidisciplinary AF team. So the multidisciplinary team actually works in a collaborative practice model. So it's, for example, as we see here, a core team where the patient in the middle, so a central role for the patient, collaborating with a cardiologist and an AF nurse, for example. But this depends on the setting, as it can also be a nurse and a general practitioner or a pharmacist, depending on the setting where the care is delivered. We may then want to expand the team by additional specialists if required and based on the individual patient case. For example, it may be necessary to have a neurologist on board or a dietitian or an exercise expert. And that is all based, again, on the individual patient case. You can imagine that if so many patients, so many people are involved, so many specialists involved in this approach, that communication and collaboration is a key component, but also coordination of care is crucial to prevent fragmentation of patient and of care and the patients being lost in a forest of specialists. And the third component is providing comprehensive treatment of atrial fibrillation. And the ESC guidelines now use the ABC approach for that. So A refers to anticoagulation and to avoid stroke, using the CHADS-FAST score to identify the truly low-risk patients who don't require any anticoagulation, or identify patients with an elevated stroke risk who may need anticoagulation. Then the B component refers to better symptom control, and this is actually the treatment of atrial fibrillation. So we need to assess the symptoms in patients and to see what patients' preferences are, and then choose for a rate control or rhythm control strategy. Then finally, the C component refers to comorbidities and cardiovascular risk factor management, as it's really important to focus on these aspects in care as well. So underlying cardiovascular conditions such as hypertension and diabetes, but also risk factors like obesity, alcohol use, and smoking are risk factors that are really important to be treated within this comprehensive treatment approach. Within the Center for Heart Rhythm Disorders, we've been looking into this extensively, like what is the effect of treating modifiable risk factors, and it showed actually that there will be more mechanistic changes, which results in a lower burden of atrial fibrillation. And in a number of studies, we've been able to demonstrate that if we treat risk factors intensively, this will lead to a reduced AF burden, an improved global well-being, and actually patients' improvement of AF freedom and less progression of atrial fibrillation. And finally, the fourth fundamental of integrated care is the use of technology to actually support integrated care. Now, on the left-hand side, we see a number of tools to measure heart rate and rhythm to screen for atrial fibrillation. This can be done by healthcare professionals, but can also be done by the patients themselves. Think about the Apple Watch, for example. There's also apps available for patients to guide them in their healthy lifestyle, how to work on that, to provide them with information, but also to encourage them, for example, in losing weight, doing more exercise, and so on and so on. And this would go hand in hand with our healthcare professional team within the clinic. Now, the healthcare professionals are also being supported, for example, by apps providing the guidelines. So there's the ESC Pocket Guidelines. This is an app freely available and to be used by healthcare professionals. But there's numerous software available to support decision-making within the treatment team. Now, if we talk about these four fundamentals of integrated care, we need to fuse them all together within an integrated AF clinic. And I think if we do that, it would be important to have at least one visit in a specialized clinic for all patients with a new diagnosis of atrial fibrillation, to do a full diagnostic assessment, and to initiate appropriate treatment according to evidence-based guidelines. Again, it's important to engage with the patients to identify their needs and their values, to educate them, empower them, and prepare them to undertake self-management in the home situation and to focus on their lifestyle behavior. A structured follow-up in the appropriate setting is required, and we can think about hospital setting, general practitioner office, but also COVID COVID-19 pandemic learned us how to use technology and to keep patients safe in their home and still being in contact with them and provide them with the guidance they need. And of course, coordination of care is really important to prevent fragmentation. So you can imagine this requires redesigning of practice and also healthcare reform. And there's a number of studies who looked into such approaches, and I would like to share a few of them with you to give you an idea of what these studies looked into. So first of all, this was the first trial performed in the Netherlands, focusing on integrated AF services, integrated care AF services, I should say. And this was a prospective single-center randomized control trial which recruited patients with newly diagnosed atrial fibrillation and randomized approximately 700 patients into an integrated nurse-led AF clinic to receive care there by the four components, as I just explained, versus usual care by a cardiologist. Follow-up was at least 12 months, and the primary endpoint was a composite of cardiovascular hospitalization or mortality. And as we can see here in the Kaplan-Meier curve, demonstrating the cumulative incidence of the composite endpoint, we saw that after a mean follow-up of about 30 months, the primary endpoint occurred in 14.3% of patients receiving the integrated AF care versus 20.8% in those patients receiving usual care, which led to a significant reduction in this primary endpoint with a 35% relative risk reduction. Recently, in a further analysis, we looked into the occurrence of all-cause mortality. And again, we demonstrated that patients who received care within this integrated AF clinic, the endpoint occurred much less compared to usual care. So this led to a significant reduction of all-cause mortality in favor of the integrated care approach. Now, recently, the RACE4 trial has been presented, which is more or less the follow-up study of the previous study I presented, but now in multi-center setting. So this is also a randomized control trial performed in 8 centers in the Netherlands, which randomized about 1,400 patients into the integrated AF clinic versus usual care. Follow-up was now at least 36 months, and the primary endpoint was similar to the previous study, so a composite of unplanned cardiovascular hospitalization or mortality. Now, over a median follow-up of 37 months, the primary endpoint occurred in 9.7% per year under nurse-led integrated care and in 11.6% per year under usual care. So the difference between both groups is remarkably small. However, in a pre-specified subgroup analysis by center experience, so meaning those centers experienced with integrated AF services, it was demonstrated that experienced integrated care centers performed much better in regards to the primary endpoint, demonstrating a significant reduction in favor of the nurse-led integrated care compared to usual care. Now, to conclude, ladies and gentlemen, I think integrated care is an emerging approach to provide multidisciplinary and comprehensive care. which consists of four main fundamentals forming the integrated care approach, which is a patient-centered approach with an active role for patients in this approach, a multidisciplinary team, comprehensive AF treatment, and the use of technology. So every fundamental is unique, important, and contributes to the integrated approach, but all these elements, all these fundamentals should be fused to make it an integrated care approach. I think it's important to improve the implementation of integrated AF services, which also requires education and improving the experiences of healthcare professionals working within integrated services. And we can then also look in further research to provide additional evidence. Thank you very much for your attention.